Welcome back to the Back on Track Achieving Healthy Weight Loss podcast. I'm your host, Dr. Alicia Shelley, and today we're talking about a historic breakthrough that could change the landscape of obesity and diabetes care in the United States. Two major pharmaceutical companies, Eli Lilly and Novo Nordisk, have reached a landmark agreement with the Trump administration to bring massive price reductions on medications like Wegovy, Ozempic, and Zepbound, which is called the Most Favored Nation Pricing, or MFN. This agreement is being called historic because it doesn't just make these drugs more affordable, it could reshape how medications are priced, distributed, and accessed across the country. Let's take a closer look on how this deal plays out across the three major channels: Medicare, Medicaid, and Trump Rx. Each has different timelines, eligibility, and cost implications. Let's start first with Medicare. Under the new agreement announced by the administration, for the first time, Medicare will cover obesity drugs, specifically drugs like Wegovy and Zepbound. And it's in cases of people who have not only obesity, but also related obesity comorbidities, such as type 2 diabetes, history of a heart attack, stroke, peripheral arterial disease, sleep apnea, and MASLD, which is the metabolic associated steatotic liver disease. They will offer these medications in a 5-year pilot program called Generous under the Centers of Medicare and Medicaid Services, and is reportedly under consideration, which would allow Medicare plans to begin covering GLP1s starting in 2027. And what will happen is that Medicaid will start participation first. Now, in the past, Medicare has not covered obesity medications. In fact, it's part of their documents of incorporation. They are unable to cover weight loss medication. But with this 5-year pilot program, this will allow Medicare to cover them for people who have obesity and related comorbidities. Under these terms, Medicare patients will pay a copay of about $50 per month for these drugs, which is exceptional, especially since currently, if you're paying out of pocket, you would have to pay between around almost $500, $499 per month, depending on the dose. It is a little bit the lowest doses with Zepbound. But needless to say, the government purchase price for Medicare under this deal is set at $245 per month for this key GLP-1. Let's switch gears and talk a little bit more about Medicaid. So with Medicaid, states will have the option to participate in the Medicaid coverage for obesity drugs for GLP-1s. Medicaid participation will be voluntary starting as early as 2026 under the pilot program. This agreement extends to all 50 state Medicaid programs in the sense that the manufacturers have committed to make these drugs available at the agreed MFN price if states opt in. And that's the big if. So it's going to be extremely important that you contact your state representative to make sure that they opt in to this type of pricing, because unfortunately, obesity drugs have been excluded or maybe covered by some states and then eventually not covered by the same states. And so the fact that they will have access to the GLP-1s is a significant policy shift. It's important that you advocate for yourself, contact your state representatives to make sure that they put pressure on the states to opt into this type of pricing. The third area is going to be Trump Rx, which is a direct-to-consumer pharmacy. Basically, they're taking the middleman out. So even though your doctor sends a prescription to the pharmacist, there are PBMs. These particular middleman basically negotiates all the different administrative things with the different insurance programs. So basically, they help get the price lower so that the insurance can be able to cover the medication. But the PBMs actually cost a lot of money. So if you remove the PBMs from the equation, now it's direct to consumer, where the patient, the physician sends the prescription to Trump Rx sends the prescription to the patient without the middleman. So it is quite helpful in this case. But under the agreement, the injectable GLP-1s like Wegovy or Ozempic will be priced at $350 per month via TrumpRx. Eventually, over 24 months, that price will decline to around $245 per month. When the oral GLP-1s, such as Wegovy's semaglutide or Lilly's orforglipirone, are approved, those starting prices will be offered at $150 through TrumpRx. Now, currently, like the Wegovy semaglutide is at the FDA waiting approval. And so they were going to, according to Lilly, the orforglipirone will be fast-tracked through the FDA. Usually it takes about 6 months for the FDA to approve a medication. It'll be faster with this agreement. Also, for self-pay patients via the manufacturer's digital channels like Lilly Direct or Novo Pharmacy, there will also be discounted pricing. So for Zepbound, the initial dose will be decreased from $349 to $299, so about a $50 decrease. And when you go to the higher doses, it'll be instead of $499, it'll be $449, so a $50 decrease. Also, when orforglipirone becomes on the market, that will be between $149 and $399. So let me summarize what I just said. Medicare, the coverage will begin via pilot for obesity conditions. The copay will be $50, but the government price for these medications will be higher at $245. But don't think the government is getting jilted here, because actually the government will start to save money as people don't need as many medications. Their conditions are more controlled. They'll use less of the Medicare, so they'll save money that way. Also, when it comes to Medicaid, there's an optional state-by-state coverage, which could start in 2026. All states have access to the same pricing, but unfortunately, they have to opt in. And then now you have the TrumpRx direct-to-consumer taking out PBMs and just allowing the physician to send the prescription to TrumpRx, which will send the medication to the consumer. This platform allows cash pay and uninsured access. Injectables will start at $350 per month. The oral versions will start at $150 per month once they are approved by the FDA. So the one thing I will say is that everything is fluid at the moment. There is, things can change based on what I'm saying as time goes on. So we'll just keep you posted if there are any further changes. The other thing I want to mention is that through this agreement, they're going to be expanding access and discounted medications to more than just obesity. So Lilly is going to be adding more affordable options to Lilly Direct, including Emgality for migraines, Trulicity for diabetes, and Mounjaro, which can treat both diabetes and obesity as well. These medications will be priced at 50 to 60% below the list price. Lilly will continue to cap insulin at $35 per month out of pocket, even with those without insurance. So this is a major win for individuals managing multiple chronic conditions, because at least you will have options that are lower on the list price. Now, I will say is that this agreement is not only about lowering prices, it's also about strengthening the U.S. pharmaceutical supply chain. So Eli Lilly will invest at least $27 billion in new manufacturing facilities across the U.S. Novo Nordisk will invest an additional $10 billion for those manufacturing facilities. And that includes plans to produce the semaglutide tablet entirely in the U.S. once it's approved. These investments are expected to increase domestic supply, create jobs, and stabilize access to critical medications like GLP-1s, including Wegovy, Zepbound, and Mounjaro, and the new oral semaglutide tablet when it's approved. So both companies have agreed to the most favored nation pricing on all new medications, ensuring that every state Medicaid program receives the lowest available price on their products. And usually it's the opposite. Usually Medicaid does not get the new pricing. And a lot of the new medications are not covered because their prices are so high. So this definitely can turn the tables on certain medications. They'll also repatriate more of their foreign profits back into the U.S. economy, which could further more domestic investment and affordability. That's a major step toward making sure Americans don't pay more for the same medications than patients overseas. Now let's talk about what this means for insurance companies, because they are not losing at all. According to their press releases, neither Eli Lilly nor Novo Nordisk expect a negative impact on their global sales in 2026. In fact, they anticipate an increased revenue because there'll be more people who will now have access to these medications, and therefore they will be purchasing more of these medications, and there'll be an increase in revenue. Because this program cuts out the middleman, the pharmacy benefit managers or PBMs, it creates a direct-to-consumer model that simplifies access and could reduce administrative costs. This change could also make pricing more transparent, benefiting insurance who often deal with the complex rebate systems. Additionally, both companies will receive a 3-year exemption from tariffs, further incentivizing them to produce and sell their medications in the U.S. market. Overall, this seems like a win-win for both pharmaceutical companies and insurers, at least in the short term. Only time will tell. So remember, these medications do more than just help people lose weight. And access matters for these people because guess what? These medications, these GLP1s, have been shown to lower the risk of heart attack, stroke, and cardiovascular death, improve fatty liver disease or MASLD, and reduce liver fibrosis. Also, they've been shown to slow progression of chronic kidney disease and improve sleep apnea and overall metabolic health. These are life-saving therapies and should be accessible to everyone, not just those with the right insurance or income level. So yes, this is a big win for patients, providers, and public health, but it's also a call to action. We need to keep pushing for consistent coverage, fewer prior authorization hurdles, and equitable access across all states. Because access to healthcare isn't just about medicine, it's about an opportunity, dignity, and saving lives. While this program, this MFN pricing and Trump RX is promising, it is still unclear if commercial insurances will expand coverage for those medications. At this moment, many commercial insurance don't cover weight loss medications due to the fact that the employer has not opted into covering them. So, if the insurance does cover weight loss medications, they make it so difficult for patients to get covered because they make them jump through multiple hoops with prior authorizations, denials, step therapy requirements before they will even consider approving the medication. And we haven't even talked about the people who are on Affordable Care Act marketplace plans. While some may be eligible for the Trump RX pricing, not everyone can afford that $350 per month. And unfortunately, this means that there will still be many Americans left behind, unable to access medications that could significantly improve their health. That's why it's so important for lawmakers to pass the Treat and Reduce Obesity Act, or TROA, which would require Medicare to cover all anti-obesity medications as well as a dietitian or exercise physiologist. So it allows them to cover all the different tools that we have in our toolbox to help people with obesity and reduce their medical comorbidities. And the one thing I will say is that once Medicare starts to cover something, then commercial insurance will also follow suit. So it's a win-win for not just Medicare patients, but also commercial insured patients as well. So while the Trump RX and MFN pricing deal represents an encouraging first step toward broader access and lower prices, there is still more work to be done. We need to keep our foot on that pedal. And it's exciting to see the government and pharmaceutical companies and insurers working together. But to truly move the needle, we must ensure that all patients, regardless of insurance type or income level, can benefit from these life-changing treatments. So it is going to be imperative that we seek out our state and national Congress and Senate representatives to make sure that they continue to keep their foot on the pedal to pass TROA, the Treat and Reduce Obesity Act, and to also for those state representatives to opt in to covering the MFN pricing for their Medicaid patients. I hope this episode has been helpful for you. I hope it kind of cleared up a little bit of all the information that's coming up so that you have a clear picture of what to expect, but knowing that things can change, especially in this day and age. But if you have somebody where this can be helpful, please feel free to share this episode with them. Don't forget to subscribe so that you can get the next episode at any of the podcast hosts that you see this podcast, whether it's Apple, Spotify, Amazon, all the above. But until next time, I am Dr. Alicia Shelley, and I'm reminding you to stay strong, stay committed, and stay consistent with your weight loss journey. And we will see you next time.